when you say to make sure that Canada is prepared to avoid a surge. There's a phrase that I've been learning this morning about flattening the curve. You know, you know you're going to see more and more cases, but it's the rate at which you see those cases, so there's not a big spike, as I understand this. So far, do you think Canada is doing a good enough job, Dr. Gupta, at maintaining just the slow spread, keeping a lid on it so it is a slow and steady spread as opposed to these big spikes?
Absolutely. I think we've been very lucky in that the curve is very flat so far in Canada. The opposite of that, you sort of have to look at what's happened in other parts of the world. Italy's been the worst, I think, for that surge and really having a curve that has led to them not having the ability to ramp up for that kind of surge in terms of their healthcare resources. We've seen an effective flattening of the curve in South Korea, though. Unclear why this is, whether it's simply the measures that they're taking in society or other factors like, we know that Italy has, the second oldest population in the world. So is it more related to the fact that they have a more susceptible population? So there's lots of different things at play. But so far in Canada, either through our measures or through sheer luck, the curve has been flat enough that our system is able to manage.
And further measures perhaps today to keep that curve as flat as possible. We are about 2.5 months now into talking about this story, you and I'm wondering what are you seeing now in your practice, Dr. Gupta?
Yeah, so I think, as you know, I'm on call this week, and that's one of the reasons that I'm here, and one of the reasons is that I'm now seeing patients potentially this week with this condition. So it's top of mind. It's what all the healthcare workers are talking to each other about. Every room that I walk into in the emergency room, I'm walking in masked. The first question I'm asking is, have you traveled? And for doctors and nurses, every day we're getting notices from the Ontario Medical Association, from our hospital, from the public health lab. So I think, it's something that all of us are, I think we feel like it may be the calm before the storm, and that's the fear. Is this storm coming?
Are you seeing and doing more testing?
Doing more testing, but seeing more cases. So, the fear is that, are we going to see this kind of surge that we've seen particularly in Italy, and what's that going to do to our healthcare system? I think that, one of the advantages we have that others don't, other parts of the world don't, is that we've been through SARS, and I was just talking to a nurse yesterday who had been through that, and there's still a lot of people in our healthcare system 15 years later who were there during SARS, and that helps from a logistical planning point of view, but I think even more importantly, it helps from a psychological point of view.
Yes.
This is not an unknown. People have gotten through something like this, and I think that's really important.
And there will be an ending. Ultimately, it will be figured out ultimately, although it doesn't feel like it sometimes in these big days of so many headlines and still a lot of mystery and concern. What has been striking to you so far, as you've seen more and more of these cases, about how this illness presents?
Yeah, I think that what's challenging about this illness is that there's a huge spectrum of disease. About 80% of people will not get really sick from this. It'll be like the common cold, sniffles, sore throat, maybe a fever, maybe some body aches. Some people will be completely asymptomatic. And that's striking because the other 20% of people will be quite sick. They'll need hospital, they'll need oxygen. And about 5% of the total will be really sick and will be on a ventilator. And we've sort of talked about 3 to 4% of people dying, numbers as high as that. So you have all the way from people with no symptoms to 3 to 4% of people dying. And that makes it really challenging both to diagnose and to contain.
And it also makes it difficult even from an individual perspective to know if you're at risk or if there's something going on with you and your own health that you need to be concerned about. I want to ask you before we go this time around about self-isolation. We're hearing about that more and more. We even have some of our federal politicians who are self-isolating because of various contacts they have had. We're just about to head into March break and people are going to travel. In terms of in your view, who should be considering self-isolation, and how do you do that effectively? I'm even thinking if you have a family, kids at home too.
Yeah, so in terms of who should do it, our public health system is pretty good about contact tracing. So obviously there's certain guidelines on returning from certain parts of the world where there are local epidemics. So folks who are returning from travel, many of them are having to self-isolate. Healthcare workers, I've got a couple of close friends who are now self-isolated because they've had possible contacts. We're also asking people who actually have the disease, who are diagnosed and have mild disease, to self-isolate. They're not sick enough to need the hospital. The practical sort of logistics of that, if you have a family and you live with other people, that's challenging. The key is maintaining distance. And so if you have the luxury of it, it means separate bedrooms, separate bathrooms, a minimum of 6 feet distance, because that's how this spreads through droplets, which can travel up to 6 feet. And then the other piece is maintaining the cleanliness of surfaces. So these droplets land on surfaces and the virus can survive for hours and even days possibly. So you've got to wipe down surfaces and you've got to constantly be washing your hands. If you're using some type of alcohol solution, make sure it's at least 60% alcohol. That's sort of the minimum cutoff for killing this kind of virus. And in addition to constantly washing your hands and avoiding the person who's quarantined, try not to touch your face. People touch their face on average 20 times a day. That's just something we do. That's how this spreads. So those are sort of the practical things that people have to think about.
Excellent best practices. We cannot remind people enough about some of those simple things that can make a big difference in slowing or stopping transmission. Dr. Gupta, thanks as always. Appreciate it for your insight. Our respirologist and associate prof at the University of Toronto, Dr. Gupta.